Our next look will be at the muscles of the ankle joint. And notice that the ankle joint here, to take off the muscles, is formed by this articulation between the talus and the tibia. Alright, talus and the tibia with a little bit of articulation from the fibula as well. What we're going to be taking a look at is plantar flexion and dorsiflexion. And if we add back on our muscles, we can see who is involved. First one is going to be dorsiflexion. Dorsiflexion is going to be when we raise our foot up towards the sky. If we raise our foot up, we are flexing the dorsum. The dorsum is this side of the foot, the dorsal side. If our foot had a dorsal fin like a dolphin, fish, or whale, you would see the dorsal fin right up here. So think of this as the dorsum of the foot. And remember that flexion is any time that we are reducing the number of degrees in an angle. And so dorsiflexion would be flexing the dorsum of the foot. Plantar flexion, on the other hand, has to do with the plantar region, which is underneath our foot. When we plant our foot and we're making a cut in a sporting event, or if we simply step on a plant, we are doing so with the bottom of our foot. And when we reduce the angle of this region, we have what's called plantar flexion. So if we're jumping up into the air, we are plantar flexing. So that's why it's a little bit unique in that our ankle joint does two versions of flexion, but it's just in the name. Alright, so starting off, let's have the tibialis anterior. It's named. Why? Because it's anterior to the tibia. It should be one of the simplest, easiest names of the muscle you can ever have. And if we zoom out here, we can see all of these muscles involved in dorsiflexion. This is dorsiflexion. Notice the toes are rising up. Foot is rising up towards the ceiling. Notice that there are a number of other muscles involved. It's not just the tibialis anterior, although that is the principal muscle that does this, but also the extensors. Here's extensor digitorum that extend the toes upward, the extensor hallucis longus, which extends the big toe upward, fibularis tertius as well on the little toe side. That's also located on the dorsum of the foot. And so if we think about it, well, all of these are inserting on the dorsum of the foot, and so when you have contraction, they're going to draw the foot upward. All right, but understand that the tibialis anterior, often called the anterior tibialis, that is going to be our prime mover in dorsiflexion. Now let's take a look at plantar flexion. Plantar flexion is going to be achieved from the triceps surae group, among others. Now, the triceps surae implies that there's three different muscles that make up the triceps surae, and that is true. We have the gastrocnemius, the soleus, and underneath the soleus we have this teeny tiny plantaris muscle, which maybe we can identify over here. Okay, the plantaris muscle is very long-tended, actually looks kind of like a plant, and underneath here it's got a leaf-like structure as it crosses the knee. But the plantaris muscle has been very important in rat studies, as muscle physiologists have taken a look at hypertrophy, because what they do is they take out the gastroc and the soleus of a rat, and they basically tell the plantaris that it's their turn to grow in order to make up for the lost musculature. And you can see different transcription factors that promote muscle growth based on those types of studies. So that's why we really care about the plantaris muscle, but it makes up part of that triceps surae group. So let's talk about these. The plantaris muscle clearly crosses, if we look at it up top here, it crosses the knee joint, and it's not the only one. We also have the gastrocnemius that is going to cross over the knee. And so if you've ever noticed, if you've done leg curls that target the hamstrings and you're doing knee flexion exercises, that you can kind of feel it in your calves as well. That's because the calves are helping out. the gastrocnemius and plantaris muscles, they're crossing over the knee to assist in knee flexion. So remember those rules of biarticular muscles, where if a muscle crosses two joints, it can help out at either joint. However, if it's already shortened at one joint, think about if we are doing seated calf raises. If this knee is flexed now and we're sitting down, that means that this muscle is already shortened. The plantaris and the gastrocnemius are now shortened. These are shortened at the knee, and they can no longer really be a prime mover at the ankle. And so when we are doing seated calf raises, we can fade these two heads of the gastrocnemius, and we can see that the muscle underneath is the soleus. Now let's take a look at the soleus. Soleus does not cross two joints. It attaches both at the fibula and the tibia and merges along with the gastrocnemius and plantaris to form the Achilles tendon. So the soleus is going to have to be the one to take over during a seated calf raise. All right, so people who want bigger calves, they will target the soleus by doing seated calf raises, and then while doing standing calf raises, standing plantar flexion, I should say, to be more specific, we have the gastrocnemius, which is going to be recruited during standing calf raises. Okay, so there's the soleus, gastrocnemius, crossing two joints, the plantaris muscle, which you may never hear of again after this video, and then a series of muscles that assist in dorsiflexion.